We need to tighten our belts. We need to fix the roof while the sun is still shining. We need to bring public spending under control. We need to reduce debt from ballooning out of control. These are some of the reasons frequently given for implementing austerity, that is, vicious cuts to both public services and benefits. However, the economics of austerity is completely flawed, and today I'll show you why. Now, the fundamental theory that austerity actually reduces public spending can be true. If the government works to reduce the amount of money it's spending, it can, in the short term, mean that it spends less money, which means it can bring the budget deficit down. It can reduce the debt burden or prevent the debt burden increasing. However, in the long term, that doesn't work. Now, the first reason why this is the case is that debt is measured as a proportion of GDP, that's the size of the economy, and austerity reduces the size of the economy or prevents the economy from growing as much as it would. Why is this the case? Well, when a government gives benefits to someone, they're going to spend that money immediately because they need to buy food and stuff. If they don't get that money, they can't buy stuff. They're not going to buy stuff, so the size of the economy is less because people are spending less money. Equally with public services. If, for example, your public transportation becomes underfunded and less usable, people are going to travel less, they're going to be able to spend less money, they're going to be able to access less good economic opportunities, therefore the economy is not going to grow as much. Likewise with healthcare. If I can't go to the hospital as easily because there's a massively long waiting list, I might not be able to work for as long, my sickness might get worse, I'll have to come out of work, come out of education, and stop being productive, therefore further shrinking the size of the economy. Now, with the economy shrinking or not growing as quickly as it otherwise might, the debt as a proportion of GDP will, even if it's in real terms shrinking, so even if it's gone down by a few billion, if the economy has gone down by more, then the size of debt as a proportion of GDP, which measures how easy it is to pay it off, actually increases, meaning the debt burden still becomes worse. Also, by shrinking the size of the economy, it decreases the amount of revenues the government gets from tax. Because tax comes out of the economy, it comes from people being paid, but also people buying stuff through value-added tax and stocks being traded and through capital gains. If this happens less, if people work less, if people are buying stuff less, there's less tax that can be extracted from the economy that can go to the government's coffers, which means that over the longer term, the government's just going to get less revenue, which means we're still going to have the same problems of increased budget deficit and increased debt, meaning that it's not actually going to solve anything in the long term. The other problem is that these services that are cut or benefits are often essential. Now, austerity is often packaged as creating efficiency, eliminating inefficiency within government spending, and so the effect is not going to be great. Certain groups or parties claim that billions, hundreds of billions, can be cut off government budgets just by efficiency savings. However, this is not really the case. Even if there are efficiency savings to make, they're very difficult to make, and austerity always leads to a reduction in the quality of services or a reduction in benefits. Now, what this means is that it creates problems because the essential services aren't there, which are going to cost more money to solve down the line. Now, my favourite example of this is, of course, healthcare. If you don't give someone, say, the necessary medical care immediately because you've cut the number of GPs so they can't get a GP appointment that easily, they could develop a serious illness which then requires far more treatment down the line, meaning that even if you're saving money in the short term, you're going to have to spend way more in the longer term. Equally with benefits. If you don't give someone enough benefits to live properly, they might not be able to find work as easily, so they're not going to be productive in the future. They might get sick more easily, and so you're going to have to pay more money later. With public transport, you reduce the provision of public transport, make it worse, people are going to drive more. You have to spend more money widening your roads and fixing potholes and the like. So you're not actually necessarily going to save money in the long term, because the same costs will come back elsewhere. Also, it can create even worse problems in times of crisis. So, by the austerity of the NHS that happened from 2010 all the way till COVID, the health service was cut, meaning that it wasn't prepared to deal with the crisis, which means that when the coronavirus pandemic hit the UK, the health service wasn't prepared to cope. It meant that far more money had to be spent building new hospitals, developing new technologies, than otherwise wouldn't have had to be spent, because the expertise and the redundancy in the system would have already been built up. As I said, that had all been cut away. So these are some of the reasons why austerity just doesn't actually work at its primary aims of bringing down the budget deficit, bringing down debt, and improving the shape of the economy. It does the opposite, and that is why austerity should be opposed. I hope you enjoyed this video. If you want to learn more about austerity and what it is, how it comes about, you can watch my first video, and I hope to see you in the next one.